Aditi, please start the session.
Yes, Dr. Lavanya, can I start with it?
Yeah, kindly start the session, Aditi.
Hello, it's me, Dr. Malkani Aditi Ghansham, BHMS PG scholar from Srimati Dprt Homeopathic Medical College, Chandwad, Nasik, Maharashtra. I am addressing you all here today for a webinar. Good evening and warm welcome to all attendees and respected guest speaker of today's webinar, Dr. Nilima Uday Pohane. Today's webinar topic is Fundamental Principles of Homeopathy and its Clinical Purview, that is, understanding its scope. Before introducing our today's speaker, initially I would like to thank Dr. Lavanya Sai, BHMS MD, PhD scholar, National General Secretary of AHISIA, All India Homeopathic Students and Youth Association. Also, I would like to thank Dr. Arpana Sandeep Parikh, ma'am, Professor and H.O.D. of Department of Repertory, Srimati Dprt Homeopathic Medical College, Chandwad, Nasik, Maharashtra. She is our today's webinar organizing secretary. Now, let's introduce our today's webinar guest speaker, Dr. Nilima Uday Pohane from Organon of Medicine Department. She is having 27.4 years of professional experience and 23.6 years of teaching experience from Antarbharti Homeopathic Medical College, Nagpur. She has completed her MD in Organon of Medicine in 2009. Since then, she had contributed much in our field by having 4 research papers published, 1 paper presentation, 3 books published, and 7 articles, and many more. I would like Dr. Nilima Pohane to start webinar and give detailed insight on today's topic, that is Fundamental Principles of Homeopathy and its Clinical Purview. Dr. Nilima Madam, please start with today's webinar.
Thank you, Aditi, for my warm introduction. But let me introduce myself. I am Dr. Nilima Pohane. So you have uttered that I was being in Antarbharti teaching since 23 years, but now I am shifted to the new institute, that is Shalinitai Meghe Homeopathic Hospital, College and Resource Center. Rectifying that, if the slides would be visible, I would start with the session. And first of all, I would like to thank Dr. Aparna Parikh ma'am, who has introduced me to this particular webinar, as well as Dr. Lavanya. I'm familiar with her always, and all the team members of AIHSAY. So, beginning with the today's webinar, that is, the topic is fundamental principle, its clinical purview. So while I have selected this topic, the main theme of this topic is that I want to initiate the basic of homeopathic subjects, because we have to build an edifice of BHMS student up to the 4th year and internship. But prior to that, we should know that what is our base, the fundamentals. If it is not, the theory is not completed, it would be very difficult to deal with the practical. So let us begin with the second slide. I have taken it as a competency number according to the CBDC syllabus of NCH. So it covers the 1.5 competency number. The competency of today's subject is understanding the fundamental principle of homeopathy. And the course outcome is having the 4th number, that is explain the cardinal principle and fundamental laws of homeopathy. So as we have to follow all the CBDC rules and regulation, then coming to the specific learning objective, the next slide, that framing the fundamental principle in any discipline such as homeopathic science, ethics or education requires a clear, logical and systematic approach. Yet how you can frame the fundamental principle effectively, the main theme is that the framing of fundamental principle is to heal gently, permanently, and holistically. For that, we need some basics, and that is enumerating the fundamental principles of homeopathy, Then explaining the cardinal principles and fundamental laws of homeopathy, though we think that cardinal principles and fundamental principles are same, but there is minor differences. So we would be going through that. And the third point of specific learning objective is describe the significance and importance of cardinal principle and fundamental laws with clinical purview. We know that in the Jesus search, Dr. Hahnemann stumbled across a substance called cinchona. He found that the description of substance recorded by a medical scholar, Cullen, was very much touching the reality. So Hahnemann's concept of simile and dynamization was in fact a revolution as never before. A new therapeutic method was born, and that was homeopathy, which has put hold imprint upon the science of medicine. Dr. Hahnemann quote, medicines could never cure diseases if they did not possess the power of altering man's state of health. The philosophy behind the whole affair, called homeopathy, was formulated by Dr. Hahnemann in 6 versions, each one improving over the previous and finally appearing under the title of Organon of Medicine. So these are the edifice on which the student should stand, and that is Dr. Hahnemann's fundamental principle of homeopathy are not an arbitrary rules, but carefully reasoned laws rooted in nature, logic, and clinical evidences. They guide every step to classical homeopathy from case taking to remedy selection and follow. It has continued to be the bedrock for homeopathic philosophy and practice. For practitioner, educator, and students, a deep grasp of these principles ensures a faithful and effective application of Hahnemannian homeopathy. Here we see that Dr. Hahnemann's principle had revolutionized the 18th century medicine by challenging the materialistic, polypharmaceuticals, and heroic method of his time. The scientific method of drug proving, the philosophical depth of vital force, the therapeutic precision of similia, and individualization collectively shaped a medical model that remained consistent over 2 centuries. So modern homeopaths like Dr. Kent, Dr. Stuart Close, Dr. H.A. Robert, and Dr. M.L. Dovle further elaborated these principles without altering their essence. Despite criticism, these principles hold relevance in both chronic and acute diseases management, offering a personalized, holistic framework aligned with today's integrative healthcare model. Coming to the fundamental principles. So we are undergoing various terms day by day. What is meant by laws, theories, or doctrine? So laws state that describing natural phenomena or relationship, but where the theories are explanatory and they observe the phenomena based on evidence. Laws describe what happened under the specific condition, while the theories explain why or how the phenomena occurs. There is certain and fixed universal laws, whereas the theories open the revision with new evidences. Uh, the development in the laws arise from repeated observation and testing, whereas in theories it arises from hypothesis and logical analysis. The laws in homeopathy may be law of similars, single remedy, minimum dose, whereas the theories is a theory of vital force, miasmatic theory, doctrine of drug dynamization and drug proving. So the differences between fundamental principles and cardinal principle, it is just a hairline, but they are the basic fundamental principles are the basic building blocks, whereas we can say that cardinal principles are leading or important principles. Most foundational truth or concern on which a system theory or disciplines is built. They are many. So fundamental principles are many, but whereas the cardinal principles are considered as the top priority and they are very few. So every accepted science in the world has its own governing laws and principles. According to Stuart Close, he says that efficiency in homeopathy implies and involves native ability, acquired technical proficiency, and logical consistency in application of its principle. The first law, what we have seen, is the law of similars. The nature's law was there already, that is similia similibus, CURANTUR, curanter, like your lives. it was not safer. So Dr. Hahnemann has modified that and he has made it very amiably and therapeutically. And he has stated that similia similibus, CURENTUR, curator, which says that let like be treated by like. So we can find nature's law in aphorism number 26. Whereas the second cardinal principle we have learned is law of simplex, where homeopathy strongly support monopharmacy, prescribing only single and simple medicine at a time. The next is law of minimum. According to the how much minimum we should prescribe, it should be according to the individual's susceptibility. Then we are knowing the theory of vital force, which has been added in fifth edition, and where the homeopathy we affirm existence of an animating vital force. The next is drug dynamization, and we know as it is a process which the medical or curative properties of the crude substance is brought out, which are latent. The next is doctrine of drug proving, the process of administering drug to healthy human being, and it was the origination of Dr. Samuel Hahnemann. Prior to that, we know that Albrecht von Haller and Anton von Streich was the person who has initiated the concept of drug proving on healthy human being. But they never experimented. It was Dr. Hahnemann who has been experimenting on the healthy human being. The next is the theory of chronic disease. All we know that how Dr. Hahnemann has arrived at the concept of the chronic miasm, psoriasis, syphilis, and psychosis, and was introduced in his fourth edition of Organon of Medicine, and that is 1829. Coming to the next, that is how fundamental principles has been uttered by Dr. H.O.D. Robert in his sixth lecture, Homeopathy and the Fundamental Laws, in the book, The Principle and Art of Cure by Homeopathy. So it is slight difference. The concept is same as that of a cardinal principle, but he has given a more explanatory with the clinical basis. So law of cure, according to Dr. H. Robert, he has uttered there the two laws, the basic law of similia similibus curenta, and the secondly, he has uttered regarding the Herring's law of cure. Regarding law of action, he has compared with the Newton's third law of motion. We would be going clinic with the clinical scenarios, how this particular law of action is implicated on patient. So it considered according to Hahnemann as a primary and secondary action. We know the third law of motion of Newton, the action and reaction should be on is equal and opposite. So as the primary action is there, how the drug gives stimulus, there appears the reaction from the vital principle. That would be the second reaction. Then the law of quantity and dose, it says that quantity of dose administered proportionate to the susceptibility of an individual, whereas the law of only quantity, where minimum doses or infinitesimal doses should be given to the patient. The law of quality says that a true similimum, not a partial similimum, should be prescribed. The law of use says that if any of the organ is not used, overused, or misused, leads to dysfunction. So we have to follow our dincharya properly so that each and every organ should be in a proper working phase. We would be going through the clinical cases. Law of biological development says that growth, function, and decay occurs according to the order and through the innate direction. The remaining laws enumerated by Dr. H.A. Roberts are law of disease development. So disease also follows a particular pattern. He says that disease develop in a particular sequence and separation distorted. The next law he has given is law of proving, where the inert substance should be proved in potentized form, whereas medicine which disturb in its natural state on functional level should be proved in crude state. The lethal drug in crude form should be proven in potentized form. So these are the rules and regulation what he has given regarding the proving. The next laws of repetition, repetition in proving, he says that repeat to evoke and suspend to observe. So repeat the medicine until the symptoms occur in a prover, and if the characteristic symptoms are observed, just stop repeating the medicine. Law of repetition of for cure. So repetition should be according to the patient's reaction. So we have to be in a keen observer where patient is giving a positive signs that he is going towards an improvement. We have to stop giving excess medication. Then let us see with a case-based scenario the application of law of similia. A 35-year-old teacher present with profuse watery coryza, bland nasal discharges, and burning acrid lacrimation was in warm room. So all we have learned is basic medicine in very first year. It is a case scenario of an LEM SIPA which has been prepared from onion, which in proving cause similar symptoms in approver. So what we can interpret that this medicine is similar to the disease case scenario. According to the law of similars, Alium-SIPA cures symptoms it can produce. The remedy was selected based on symptom similarity. Let us affirm the application of law of simplex going through the case scenario. Law of simplex suggests a single and simple medicine. Single, we know that one medicine at a given time, but simple means unadulterated medicine should be prescribed, which has been given in reference to aphorism number 273 of Organon of Medicine, 6th edition. So here goes the case. A 9-year-old child with ADHD shows extreme restlessness, constant movement, impulsivity, and destructive outbursts. So here we know the ADHD common symptoms and the uncommon symptoms of tarantula. Here, the tarantula is matching with the case scenario of a child, and it was been prescribed according to totality in a given doses. So this illustrates the law of simplex that we cannot prescribe lot many medicine at a given time, whatever may be the disease diagnosis. So you know how the polypharmacy is applied in a given condition, whether whatever may be the diagnosis. But if we are a homeopath, we have to follow that. The illustration of law of simplex says that one single well-selected remedy avoids confusion and allows accurate observation of the remedy effect. So the next is law of minimum. The reference has been given of law of minimum. I think someone mic is on. Is there any problem? Kindly unmute your mics. Reference of law of minimum has been given in aphorism 275, 246 to 248. Here goes a case scenario. A woman with anxiety and panic attack was prescribed Aconite Naphthalus 200 c, a single dose. After that, the result was also was after one dose, her panic attack was reduced significantly within 2 days. No repetition was needed immediately. So interpretation out of this particular case scenario is that using the minimum dose ensures maximum benefit with least medicinal aggravation, and repetition was based on return of symptom and not a routine. The application of drug proving, how we can correlate this in clinical scenario, we know that the concept of drug proving has been very well explicated in aphorism 105 to 145, where the case says that a proving volunteer took Naxwamika 30C over 3 days and developed irritability, constipation with ineffectual urging, oversensitive to stimulus. So this particular case scenario was observed during drug proving. It was verified, re-verified, and the Matra Medica, the symptoms of Naxwamika was been noted. So these symptoms become a part of Matra Medica. Later, a patient with similar symptoms was successfully treated with Naxwamika based on proving data. So disease symptom is matched with that of the symptoms of a drug from Materia Medica. That's why we called it as a similia similibus student. So the next concept of vital principle, which has been explained very nicely in 9 to 17, most probably the concept of health disease and cure in 9 to 12. A 52-year-old man had no detectable pathology but presented with fatigue, sadness, poor sleep, and no will to live. His laboratory investigations were normal, were indicated remedy for this case scenario is phosphoric acid and was prescribed based on emotional and vital exhaustion. Interpretation. Though no cross pathology was evident, the vital force was dynamically deranged. The correctly selected remedy stimulated the vital force to restore the health. Next, cardinal principle, that is application of drug dynamization, which has or known as potentization has been correlated in aphorism number 269. The case goes here is a woman with rheumatoid arthritis responded only to Bryonia alba 1M, even though crude Bryonia had no effect. So patient tries many things when the pain starts, but not no any crude drug substance responded to this patient. But after giving Bryonia alba, which was an indicated remedy according to the totality of symptom and individualization, the patient responded to this potentized medicine because we know that the three vital dynamics, the health dynamics, that is vital principle is dynamic, the disease force is inimical, which is also dynamic, and the action should be on the same plane. So we use the medicine which should be on the dynamic plane. So we dynamize the drug. So in this condition, potentization liberate the dynamic medicinal energy, making it suitable for stimulating the vital force in dynamic disease. The theory of chronic disease, we know that how after 12 years of hard work, Dr. Hahnemann arrived at the theory of chronic diseases. And this theory of miasms has been explained very well in the literature of chronic diseases. Its cure and homeopathic treatment. References has been given in aphorism number 78 to 81 and in theory of chronic diseases. The case goes like a child had repeated skin eruption, constipation, and fear of darkness. She also had a family history of eczema and asthma. So, observing these symptoms, the case scenario is correlated with the sulfur and it was prescribed and after observing the psoric tendency of a patient. Underlying psoric miasm was addressed for lasting cure and without anti-miasmatic treatment, suppression or recurrence might result. So whenever there is underlying chronic diseases and the miasm should be identified and anti-miasmatic treatment should be given in any case to cover the totality of symptoms. Then coming to the fundamental principles of H.O.D. Robert, the reference is in the Principle and Art of Cure, the sixth chapter of Dr. H.O.D. Robert. A case goes likewise that a 28-year-old man suffers from chronic eczema on his leg for 4 years. He had asthma during childhood at the age of 7 to 12 years and treated with inhaler and steroid. Asthma disappeared, but eczema developed later. Recently, patient had complained of intense itching of eczema, aggravated at night, scratching, leads to bleeding, feels anxious, irritable, cold drinks aggravate, and the skin eruptions also aggravate. Sulfur 201 drop single dose strat was prescribed. After taking sulfur within 2 weeks, the patient notices eczema has started drying up from above downward, that is from the shoulder to ankle. Old mild wheezing returns for a few days but subsided without inhaler. Overall, energy improves and appetite was normal. So we observe that the physical generals of patient get uh, cover up whenever there is an observation of Herring's law of cure. So here the cure is proceeding from within outward. The deeper pathology, that is asthma and lung conditions, reappear mildly, but they are uh, tolerable, while the superficial skin is healing. It moves from above downward. Eczema clear first from the upper part, and then it subside from the lower extremity. The old suppressed asthma symptoms comes back briefly, showing the reverse order of appearance, and the vital force is restoring balance naturally. So this was of law of similars according to H. Robert. The next law, what he has explained in the chapter, is the law of action. So what it suggests. A 45-year-old man suffers from insomnia for months and he feels restless. Overthink at night, becomes drowsy towards dawn. He has taken strong sedatives regularly. They knock him out, but he wakes groggy or unstable and dependent on pills. Now, even higher doses don't help. So, on the basis of totality of symptom, the medicine indicated was coffea cruda and a single 200 potency was selected. Interpretation of this case suggests that the small potentized dose of coffea cruda acts as in a primary action. It gently stimulates the vital force. The secondary reaction is the vital force restoring balance, and the patient naturally feels sleepy. Unlike sedative, this doesn't paralyze the nerve and it reestablishes the natural sleep mechanism. outcome of law of action says that within a few days, the patient falls asleep naturally. No grogginess, no dependence. Sedatives are stopped gradually under the guidance. Interpretation of this law of action says that the primary action, the remedy acts as a dynamic stimulus. The secondary reaction, the patient's self-regulating power, correcting the sleep rhythm, which results in a true cure and not in suppression. Affirming the law of quantity and dose, explaining the law with a case scenario, a 28-year-old woman with acute urticaria complaining of a sudden red itchy wilts after eating shellfish, was at night, feels hot, restless, want cold air, itching better by cold bathing, anxiety and fear, feels suffocated. Totality of symptoms indicate a medicine from Medica, and that is epismel. So epismel 200 potency, one single dose with other auxiliaries are given. Itching subsided in an hour, swelling receded overnight, no aggravation and no suppression. The minimum quantity gently stimulates the vital force, brings prompt relief, avoid aggravation. So it is not a miracle or not a magic, but homeopathy is a true science and where you can see this action of medicine within few hours. So here, Dr. H. Robert quotes that quantity has meaning only in its power to evoke a qualitative vital response. So we don't have to overdrug a patient. So we have to judge it from the susceptibility of a patient. And we know that there are 7 modifying factors which judge the susceptibility. We can judge the susceptibility of a patient, that is through the age, habit, temperament, or constitution. And there are many other factors that how we can come to the conclusion whether the patient's susceptibility is low or high or moderate, and then we can prescribe the correct potency and correct repetition. The quantity of drug required is in inverse ratio of the similarity. So higher the similarity, less frequent repetition of the medicine would be there. So we have to match the similimum. Is covering the 6 points. That is location, sensation, modalities, ailment from, and many other points. So 6 points we have to cover whenever we are selecting a homeopathic medicine. The next is applied law of quantity. The reference is H. Robert, where the case scenario says that a 35-year-old man with chronic sinusitis reporting with thick greenish nasal discharges, frontal headache, was in warm room with a past history of frequent cold suppression with antibiotics. Mentally, the patient is impatient, want quick relief. Vitality of a patient is good with strong constitution. So here the neophyte intern student has prescribed pulsatilla 6C, just indicating the greenish discharges. But we cannot prescribe from the 1 or 2 symptoms, but we have to cover a totality of symptoms. Even if it is a keynote greenish discharge in pulsatilla, we have to match with the minimum 3 symptoms. So every tool should have a 3 legs according to keynote prescribing as stated by Gersney. Patient not temporary relief with relapse of symptoms. So it was partial similimum, so it had relief temporarily, but the symptoms was relapse. So then based on the complete totality, which covered irritability, chilliness, and overuse of drugs, Naxwamika 200C single dose was used. Here, a high quality prescription in dynamic strength was given. Discharges flow freely, frontal headache was cleared, and vitality had improved of the patient. Interpretation from this, we can do that the dynamic quality, right remedy, and right potency with a correct repetition is required. So a dose, what it means, it covers the 5 criteria: the similimum, the potency, the correct form, quantity, and repetition. So it should be in an exact way, and it comes with a practice. Then next is applied law of quality. Here, case scenario of 2 patients has been explained. Patient A robust man, 40, age 40, rarely ill, not very sensitive. And the case scenario of patient B is a delicate girl of 18 years age, very nervous, oversensitive to stimuli, gets strong reaction from any drug. So after case taking, you find both the matches with the belladonna. So patient A, you may give belladonna 30C repeated maybe once daily. In patient B, because she's highly susceptible, you can give the higher potency of belladonna 200C, a single dose, and wait, or even use a lower potency, that is 6C, in a single dose. So this is an art, and many of the clinicians had given their own technique of utilizing potency, but the total is that we don't have any instrument of precision to judge how much potency should be given or how much dosage should be given. So that is upon the reaction of patient, we have to judge the selection of medicine. So coming to the conclusion, law of quantity and dose says that patient B needs less quantity due to high susceptibility, and law of quantity says that if you give patient B the same dose you gave to the patient A, it might aggravate strongly. The reaction is stronger in more susceptible patient even with less medicine. So we have to be cautious while prescribing the medicine accurate potencies. So law of quality says that if you give patient B a wrong remedy with poor similarity, you would see no result or new symptoms. If belladonna is the exact match, the headache should resolve very gently. So applied law of quantity of dose, law of quantity and law of quality has been referred in this particular chapter, that is in book and the chapter of 6. So it says that the quantity and dose tailor the dose to the patient's sensitivity. The quantity says that reaction strength depend on dose versus susceptibility. And law of quality says that the match determines whether the reaction is curative or disruptive. Coming to the next law, the applied law of use. And here, let us go through the case scenario that Mr. Ramesh, 42 years old, he was an IT professional complaining of a lower backache, weakness in legs, and general fatigue. The background of this particular symptomatology was Mr. Ramesh had switched from an active field job to a desk job at the age of 30. He worked 12 hours a day, rarely exercised, sit for long hours, and eat irregular. Slowly developed stiffness in lower back, mild weight gain. His doctor advised rest and analgesia. He took complete bed rest for 3 weeks when pain worsened. After that, weakness and stiffness was increased, and now even mild walking causes him discomfort. So, what is interpretation of this according to the law of use? So, due to disuse or prolonged sitting or no physical activity, the muscle supported his back weakened. Rest prescribed in excess worsened the problem. The unused muscle atrophied further. The joint stiffened due to lack of movement. His vital force, instead of flowing dynamically through the use and activity, had been stagnant. So, moral of the case scenario is that the organ that are muscle and joint weakened due to disuse. Excess rest was misuse, aggravating the issues. Proper use is needed to restore the function. So, we have to take care of diet and regime while the medicine has been prescribed, or whenever the patient falls ill, we have to rectify all the exciting and maintaining causes unless and until the medicine will not be beneficial. So the law of use in action says that function maintains the organ. So as much you use these things, so we know the examples from Darwin theory. So there was what tail to the man, but he has not used the tail, so it has been disappeared. So likewise, we have to keep each and every organ in function. The homeopathic remedies awaken the function, so it stimulates because we prescribe minimum and dynamic medicine. The patient cooperation, that is lifestyle, ensures continued use, preventing the relapses. So this was law of use. Next law, which has been explained by Dr. H.O.D, is the applied law of biological development. It suggests that all living plants, animal, human grow functions, defend themselves, and decay according to the natural law. This covers growth, nutrition, self repair, reproduction, adaptation, and defense against diseases. The vital force directs this orderly unfolding. If this natural development is obstructed by wrong habits, poor environment, or wrong treatment, the orderly process is disturbed. So, key point from this law of biological development says that the biological development of man proceeds according to definite law. The physician's duty is to work within this law to restore the order. Coming to the case scenario of biological development, a 4 months old baby boy with mild self-limiting diarrhea, exclusively breastfed, and diarrhea was greenish with mild dehydration. The child was irritable. So, if this is the natural phenomena, where whenever any foreign body or foreign material goes, there the body tries to overcome of it naturally, and then the bowel movement was increased in this particular child. So, mild diarrhea settles naturally, gut flora remains healthy, baby's digestion matures naturally. But in such condition, if we hesitatedly give any of the suppressive or palliative medicine, what will happen? The natural healing will be disturbed and the case will be in a palliation or suppression. So, interpretation, the baby's vital force and natural gut development are left to complete their work. If we don't give any of the medication, just try to overcome the patient naturally, what will happen? The law of biological development is respected, natural immunity and digestion strengthen, improves. The baby's gut organism gain resilience with gentle support. So, right approach as respecting the law of biological development, recognize mild infant diarrhea as self-limiting, support biological functions, ensure continued breastfeeding, advise mother diet and hydration, and give single dose of indicated dynamic remedy, enhancing the patient's condition. So we have seen acute disease, that is indisposition and acute disease, where the medicine is required if it is continuous symptoms, and if it is indisposition, it would be overcome by itself. But you don't have to overdrug the patient unnecessarily. The law of biological development, but if the diarrhea is stopped forcibly by any palliative or suppressive drug, then the baby may develop indigestion with colic, frequent bloating, and oral thrush. The natural self cleansing of a gut flora, part of healthy biological development, is disturbed by chemical suppression. So, what is the practical takeaway from this particular case scenario is that the human body has an innate intelligence to heal, grow, and adapt. Homeopathy assists this intelligence. It never fights or blocks it. Biological development must be trusted and supported with minimal, precise remedies and good lifestyle support. Then next comes the law of disease development. So here we know that a disease follow a particular pattern. So from outside to inside, from lesser important to more vital organ, and then it follows a particular sequence. So in this case scenario, let us say that a 28-year-old woman is diagnosed with chronic eczema on hands since past 6 years. In past history, she had frequent colds and nasal catarrh every winter at the age of 12. At the age of 15, she reported taking antihistaminics and nasal spray for cold, which led to suppression and development of bronchitis. She was prescribed repeated antibiotics, and since then, at the age of 22, she developed constipation, which became chronic, and then laxatives were prescribed. So, at the age of 24, developed skin eruption, that is eczema on hands, used topical steroid, and presently the eczema kept coming back worse every time she stopped taking steroids. So, analyzing this particular law of disease development, initially, this particular lady, her disease was on the mucous membrane. Suppression shifted one disease deeper on the respiratory mucosa, and she was suffering from bronchitis. Suppression again with antibiotics had no cold but GI tract affection, that are constipation. Suppression again, that is with laxative, and here the skin tries to throw out the toxin, and she was been diagnosed as eczema. Suppressed again with local topical steroid, and eruption kept recurring in deeper each time. So we have to observe the embryology. So how here there is a skin eruption, but is it on a which layer, that we have to observe. So every skin eruption is not. Interpreting the law of disease development, here disease shifted from functional frequent colds to organ involvement, that is on diagnosing as a bronchitis and involving gut with constipation. Finally, it manifested on the surface that as a skin eruption, an attempt by the body to externalize the disturbance. Suppression of skin eruption risk driving the disease back internally, possibly leading to asthma or deeper pathology. The key points of this particular case scenario is that this illustrates how disease evolved stage by stage, functional, tissue, and then structural, and how improper treatment suppression can push the disease in a deeper layer. Then comes the law of proving. So these were the different laws which has been explained by H.O. Robert, and this comes the law of proving. Law of proving has been stated in three ways. So he has stated the first statement is that any drug which in its natural state affect the vital energy but little will develop a proving only in high potency. जैसे charcoal है, it doesn't react to the vital energy. जैसे नमक है, जैसे silicia, sand है. So let us explain this particular statement with a case scenario. A 25-year-old student had recurrent boils that do not heal completely. He feels chilly all the time and sweat on his feet, which is having a foul odor, and lack confidence to complete his studies. He is timid and easily exhausted by the mental work. So we know that this case scenario is correlated with that of the medicine silicia. So in natural state, giving him silicia or sand would do nothing. So we know that it is inert. It will not react. But if we give the potentized silicia of 200 potency, what will happen? A homeopath, when prescribed silicia according to symptom similarity, and after repeating doses according to the need of a patient, the boil comes to head and discharged properly. The patient gradually feels more stamina for mental work and his fit sweat become less and he gains more confidence. So we can observe this action in day-to-day OPD and IPDs. Interpretation of this, the natural substance silicia does not have this dynamic power in its crude form. Only the potentized medicine can stimulate the vital force to bring out both proving symptoms and the curative action. So that's why we prescribe a dynamic medicine. The law of proving, second statement says that any drug which in its natural state disturb the vital energy to functional manifestation only may be proven in a crude form. So we have a list of medicine which can disturb functionally. So in a simple word, if a substance already produces observable functional symptoms like vomiting, diarrhea, dizziness, sneezing, cough, in its raw or crude form, then it can be proven without potentization. So we can prove that particular medicine in mother tinctures or crude because its action on the vital force is already significant enough. The case of ipecac has been explained over there. A child has a constant nausea with clean tongue, vomiting after food, and stomach feel relaxed, no thirst. In a crude form, indeed the ipecac syrup will aggravate, it will never cure. Is still used to induce the vomiting. So if it is given in crude form, it will aggravate the nausea and vomiting. But if it is given in an potentized way, that is 3x or 6C potency according to the need of patient, the it would provoke, it will match this symptom and the patient will be relieved from the condition. It is observed all the way. So silicia in a true drug need potentization for dynamic effect, whereas ipecac already active produce clear symptom even in a raw form. So Robert principle here is stronger the crude substance's capacity to cause functional or toxic symptom, the less potentization is required to prove it. So here there is no any patient that we are discussing regarding the prover. So Robert and Kate both use this to explain that why certain poisons like arsenic or herbs that are aconite or belladonna can be proved even in crude tincture or low potencies. They strongly disturb the vital force through functional or toxic effect. So whereas inert substances like charcoal, graphites, or silicia need potentization to liberate their dynamic medicinal action. So all indication, all principles are regarding health, disease cure, proving, and reputation. The third statement of proving, according to H.O. Roberts, says that any drug which in its natural state disturb the vital energy to destructive manifestation should be proven only in a potentized form. जब भी हम proving कर रहे हैं तो ये जो medicine उसका habitat, उसका पार्ट यूज और उसकी टॉक्सिसिटी, उसका स्फेयर ऑफ एक्शन देखने के बाद उसको कौन से पोटेंसी में प्रूव करना है हमें वो अफर्मेशन आना चाहिए. So let us see the case scenario. A 50 years old man has severe food poisoning with violent vomiting, burning pain in stomach, intense thirst for small sips, great restlessness. He wants to change position constantly. He fears he will die. The interpretation of this particular case scenario is that drugs that have violent, destructive, even deadly effect in their crude form are too dangerous to test directly on healthy human beings in crude doses. So they act so violently that they destroy tissue, cause organ damage or death. They do not merely produce functional or mild dynamic symptoms. Therefore, safely reveals the full symptom picture. They must be potentized or dynamized. So they retain the dynamic power but lose the toxic material destructiveness. The next two law remainings are the law of repetition and the repetition in proving and repetition in cure. So in repetition of medicine in proving, there goes a dictum is that never repeat your remedy so long as it continue to act. तो जब भी ड्रग प्रूविंग कर रहे हो और आपने मेडिसिन दिया है प्रूवर को और वॉलेंटियर को और उसकी एक्शन हो रही है तो नेवर गिव अनदर डोज. So in proving, the repetition of the dose must be continued until the symptoms are obtained, but stop the moment characteristic symptom appear. Otherwise, we may engraft spurious or drug disease state on the prover. So we have an example of Dr. Constantine Herring. He proved lachesis up to the point whereas he was oversensitive to wear the necktie. So be cautious while drug proving. Interpretation from this, a healthy prover takes Silicia 30C 1 dose. No symptoms appear within 24 hours. Prover takes another dose. The mild headache had been developed. That is a common symptom. But another dose, prover developed cold feet, night sweat, splinter-like pain. At this point, the proving supervisor stops further doses and the proving state is now fully established. If they kept repeating, the prover could develop artificial drug disease and or the pathological condition and not part of the genuine dynamic drug proving or suppress true symptom sequence by excess dosing. So repetition in proving says that until clear, definite characteristic symptoms emerge, then stop giving the medicine to the volunteers. Then next is the law of repetition for cure. Never repeat the dose while symptoms are manifested from the dose already taken. So here goes the case. A man with a chronic eczema gets sulfur 200C a single dose. The eruption gets redder, more itching for a few days, then slowly dry up. New symptoms, old suppression piles reappear. A sign of Herring's law of cure, internal disease moving towards out. So what does Dr. Roberts says is that do not repeat sulfur immediately. Wait for the reaction to exhaust itself. If improvement stalls and old symptoms are gone, then repeat only if same totality returns. If totality changes, you have to shift for another drug. If new layer appears, reassess for a new simillimum. So this is totally and completely on the physician's observation. That's why Dr. Hahnemann has uttered that he should be an unprejudiced observer and a keen observer. So this is one of the qualities of a physician which gives us a complete and gentle cure. So summarizing the fundamental principles of homeopathy, it is a holistic, individualistic, and dynamic system. It is healing art grounded in immutable law of nature. Cure is possible only by applying these principles systematically and not mechanically but intelligently. So, by this, I would like to acknowledge All India Homeopathic Students and Youth Association, Dr. Lavanya, the National General Secretary of All Indian Homeopathic Students and Youth Association. Most thankful to Dr. Aparna Parikh ma'am, the organizing secretary, Dr. Ashita and Dr. Aditi, the anchoring team, and all my hardworking students who are eager to implement the fundamental principles thoroughly throughout their practice. And by this, I had say to all the team, thank you. Thank you, ma'am. I have completed with my same. Lavanya ma'am, Parikh ma'am, if you are there.
Hello, ma'am. Am I audible, ma'am?
Yes, ma'am.
Thank you, ma'am. Thank you so much for the extensive session. It will be quite good session, ma'am. So we have learned so many things from this session. The respected participants, if you have any questions, just comment in the comment box so that madam will be answering.
This is most important topic for first year student because uh, according to new syllabus, we have 20 lectures and 5 non-lectures. So understanding this topic is most important.
Hope they are clear with the session, ma'am. Aditi, please end the session.
Okay, thank you so much. Thank you all students and all the diligent.
After this wonderful session, I would like to say thanks wholeheartedly to Dr. Nilima Pohane, madam, for giving a brief information on such a useful topic in day-to-day life, most important for students as well. With this, I hope all the attendees have understood the lecture well, and I would like to end the session here. Thank you each and everyone for the cooperation, and our today's guest speaker, Dr. Nilima Pohane madam, and General Secretary Dr. Lavanya Sai, and Seminar Organizing Department Dr. Arpana Parikh ma'am.
Thank you.
We'll meet tomorrow with a good webinar in few upcoming sessions.
Respected ma'am, thank you so much for the session. Participants, there is a small announcement for you guys. So we will be starting with the blogs who are interested to write any articles, to write regarding any topic. So they can just send their draft of the article in a Word format or PDF format in Times New Roman 12 to the ISA General Secretary. So whatever the topic you have been sent, that will be reflected in the blog. So kindly make use of this. So you'll be having a good sessions, upcoming sessions also. So thank you all. Thank you so much. So I repeat once again. So kindly send your articles or whatever the content you want to present to the blog, so that our team will take care to present that content in the blog form. So you can send the content to the given mail ID. Yeah. Thank you all. Thank you so much.